Good morning, everybody. It's Dr. Brace here. Welcome to Facial Plastic Fridays. For the last few weeks, we've been talking about facial fillers, and if you're interested in those and why we put fillers in certain places and which fillers we use, you can go back and check the stories from the last few Fridays. Today, I wanted to be a little more technical and talk about the difference between needle and cannula. This is a question that sometimes comes up in clinic where people ask, are you going to use a needle or are you going to use a cannula? And the answer is that I use both. And so areas where I like to use the needle is in the lips, and then when I'm placing filler on bone, so on the chin, along the jawline, on the cheeks. I like the needle in those situations because it's small, and what I usually use is a 30 gauge needle, so it's comfortable. It's a tiny little guy here. It doesn't usually come with most fillers. Most fillers have a 27 gauge needle, but some of them do have a 30. If it doesn't come with a 30, I put the 30 on because it's more comfortable for patients. It's a smaller needle. For the lips, it's very precise, and you can get very close to what you're trying to fill with minimal kind of tissue involved. That's different than a cannula, which is a much longer, put the two beside each other here. The cannula is a much longer needle, but it's a blunt tip, and there's good reasons to use that. But here's a needle, here's the cannula, and so there's a little difference in length there. So if I'm injecting lips, chin, anything periosteal, cheeks, jawline, can be precise and exact and go right onto the bone with the needle. When I'm filling nasolabial folds, tear troughs, temples, supraorbital hollows, I like the cannula better. And the reason I like the cannula better is because in those injections, I'm usually in a more superficial plane, and in that more superficial plane are where the blood vessels live. And facial filler, to be successful at it and to have good outcomes, requires a strong anatomical knowledge to avoid danger areas. But sometimes you have to inject in danger areas, and in those cases you want to be as safe as possible. And so what I love about the cannula, I'll show a close-up picture here of it, is that it's a blunt tip. And so one of the things we worry about in facial fillers is doing an intravascular injection. So injecting filler into a blood vessel, which basically creates a clot. And that clot can travel forward or backwards, block blood flow to the skin, and in some cases block blood flow to the eye or blood drainage of the eye, and cause issues like skin necrosis or vascular insufficiency, and in kind of scary cases, blindness. And so if you're going to be injecting an area that has a lot of large blood vessels around it, like the angular artery here, like the supraorbital and supratrochlear arteries up here, like the infraorbital arteries and the infratrochlear arteries around the eye, you want to be as safe as possible. And the way you're safe as possible, one of the ways you can be safe as possible is using a cannula. Cannula is a blunt tip, so it's very difficult to put a blunt tip. I have it here in my hand. It does not hurt to stick your finger on the end. It's not sharp. It's very difficult to get into a blood vessel. If you were somehow successful in taking this and getting it inside the lumen of a blood vessel, the port that you inject on is actually away from the tip, is set back. So even if the tip of your cannula was in a vessel, when you push on the plunger, the filler comes out a couple millimeters behind that tip, so it's an added layer of safety. So that's really the main difference between a needle and a cannula. A needle is a sharp end, it's precise, it goes right where you put it, and it's great for injecting deep on bone and in lips where you want to have kind of very, very precise placement in that tissue layer. A cannula is great for when you're treating more superficially or treating in danger areas where you can inject a filler with more confidence of safety because you're protecting the vessel from an intraluminal injection and you are injecting away from the tip. So even if you did have pressure inside a vessel, you can avoid it. There's lots of nuances to filler. Filler does take a lot of training to do it well, and a lot of experience to be comfortable injecting in areas that are more high risk. So make sure if you're thinking about filler that you have all the information you need and you see an expert. Send us your questions on facial filler, questions about cannula and needle, and I'm happy to answer them. And everybody enjoy the weekend. Have a great Facial Plastics Friday.